For this presentation, I will be discussing how a behavior analyst can implement ABA principles and interventions within the area of sports, health, and fitness. The following slides will include the learning objectives you will be able to do upon watching this presentation, defining what sports and fitness entail along with the role and responsibilities of a behavior analyst within this subject area, types of behavior analytic interventions. Previous research in this area have demonstrated effectiveness, practicing and abiding by the ethics code, and ways to obtain competence and knowledge to practice ABA in the area of sports and fitness. With that, let's begin. For this presentation involving ABA in the sports, fitness, health area, I have identified 4 major learning objectives, components you will be able to master upon completing this presentation. The learning objectives are as follows. You will be able to describe how the 7 dimensions of ABA are fulfilled within the area of sports and fitness. 2, identify and describe the types of interventions that can be used to improve sports performance. 3, identify and describe the types of interventions that can be used to motivate individuals to maintain a workout routine. And 4, describe ways to further education and training in sports and fitness using ABA principles and interventions. According to Kansas State University's Department of Kinesiology 2021 department page, they define regular physical activity as any movement of the body that requires energy expenditure. Now, back referencing the National Institutes of Health article from 1985, they describe physical activity, exercise, and physical fitness as 3 separate components. Physical activity they describe that can be occupational, sports, conditioning, household, or other activities. Exercise they describe as planned, structured, and repetitive. And then they also have a final or intermediate objective with it. And physical fitness is a set of attributes that are health or skill related. Also, sports performance is the way sports participation and outcomes are measured with using ABA principles and interventions. In a study conducted in 2010 by Stokes, Laselli, Reed, and Fleming, they implemented an intervention treatment package with high school football players involving the coach delivering descriptive feedback in the form of praise and correction, video feedback, watching practice videos, and performance feedback using teaching with acoustical guidance, or known as TAG. This study demonstrated an increase in application of learned skills, tackling, and generalized from practice to in games. However, further research is warranted using behavior analytic interventions across other sports to evaluate their effectiveness and generalization along with across athletes, so from beginner to elite professional. Some of the sports performance that has been studied over the 3 decades primarily have been focused on baseball, basketball, figure skating, football, ice hockey, soccer, swimming, and tennis. According to Laselli and colleagues in 2011, the focus was mainly with interventions to directly implement with athletes, also with consultation with coaches and trainers. Based on the article conducted by Schenk and Miltenberger from 2018, they reviewed a plethora of research studies conducted using behavior analytic evidence-based interventions to increase sport performance among athletes across a variety of sports. The following interventions are ones used most often and have demonstrated effectiveness on improving and maintaining high level of performance within the sport. The first one is video modeling and video feedback. Now, these two kind of go hand in hand or can kind of be paired together, as well as with verbal feedback. So with video modeling and video feedback, Athletes or participants watch, observe playback of recorded performance of behaviors of a specific sports skill. Also, video feedback, which is feedback provided following engagement in the target behavior, most often paired with verbal feedback, which is praise, or in the form of praise and error correction. This is providing verbal statements to the athlete on performance of target behavior via a coach, teammate, or other person involved in the sport. This is often separate from video feedback. Another intervention is positive and negative reinforcement, which is a consequence procedure delivered, removed, contingent on response or behavior emitted, which would produce an increase in behavior that would have a likelihood of future occurrences of the sport or specific skill. The next intervention discussed is goal setting, which is a antecedent procedure, with teaching athletes to create goals, short and long term, for them to achieve mastery with a specific skill component of their sport to improve their overall performance. As we continue, the next intervention most often used is public posting. This entails posting the athlete's performance in a public place or location in order to help influence their and others' sport and athletic performance. This type of intervention is used as a type of feedback procedure as video and verbal feedback is. So again, with public posting, it is used to influence the participant and others. So for example, their teammates, sport and athletic performance. Modeling, or expert modeling as it's also known as, is another intervention used as an antecedent procedure. This is when someone who is considered an expert in the sport, such as the coach or other individual, demonstrates the specific sports skill component or target behavior to the athlete participant. Also, this can be delivered in two ways: in person or live, or by video. So for example, video modeling. So the expert is demonstrating the skill by video rather than the athlete watching their own performance on video. So there's the difference between the expert modeling and video modeling. Another intervention often used with increasing sport performance is self-monitoring and graphical feedback. Now, with self-monitoring is used to teach athletes to record their own performance on a skill or behavior, to track and take accountability for their practice to increase their own performance. When using graphical feedback, a coach, behavior analyst, or other individual will use graphs to visually provide athletes with their progress or improvement of the desired sports skill. Auditory feedback, or also known as teaching with acoustical guidance, also abbreviated as TAG, is used primarily as a consequence procedure. This is utilized by a coach, behavior analyst, using a clicker to provide immediate feedback to the athlete when each step of a behavioral sequence is performed correctly, to increase the likelihood the behaviors are emitted in future occurrences and maintained long term. So for example, this was used in a previous research for teaching dancers to perform dance steps in a sequence, as an example. Also, Schenk and Miltenberger in 2018 discussed that there is still more research to be conducted using the intervention of TAG to evaluate its effectiveness and maintenance factor. Sports and fitness and within the dimensions of ABA. So within the 7 dimensions of ABA, sports and fitness interventions fulfill the applied dimension by using specific intervention being utilized. Again, also reinforcement and feedback, and within the actual designated sport. So in the actual applied setting of where the sport takes place, whether it's in practice, or game setting or competition setting. It fulfills the behavioral dimension of ABA as it demonstrates an improved performance of the targeted skill component, or the athlete or participant emitting the behaviors in order to increase or improve their performance in the sport. The analytic dimension, of course, because we take data collection, that's the highly effective, as well as using functional analysis in order to identify what the target behaviors or the specific skill components of the sport need to be targeted for increase. Conceptually systematic, again, using evidence-based behavior analytic procedures. So again, going back to modeling. Also BST, which is in the sense of training coaches to implement interventions, like modeling, chaining, positive negative reinforcement, how to apply positive and negative reinforcement in the form of praise or corrective feedback to their athletes. The affective dimension, again, demonstrating future occurrences of the target behavior, or the specific skill correctly and accurately following intervention. Technological, using task analyses, BST training, coaches and other sport personnel to implement interventions accurately. So again, tapping into that fidelity for improved performance of their athletes. And generalizable, so the athlete applying the intervention and improved skill within the natural scenario. So from taking it into practice, contrived scenarios, and applying those into game or competition settings. As the World Health Organization and other medical and fitness professionals have identified obesity as a common and huge threat to human longevity and early mortality rates, according to Samdell and colleagues from 2018, their article, they discuss how the WHO created a global action plan and proposed to a variety of national governments to implement in order to help decrease the rate of obesity among its populations and focus on increasing the likelihood the population of their subsequent countries or governments will engage in regular physical activity and exercise. Regular physical activity is defined as engaging in moving the body and engaging in moderate to vigorous exercise at least 5 days a week. Examples of physical activity and exercise include, but is not limited to, brisk walking, yard work, and bike riding. The WHO also mentions that the lack of engagement in regular physical activity has an inverse relation to a higher risk of contracting non-communicable diseases, or NCDs, which can be preventable with regular physical activity exercise. And these NCDs, for example, involve diabetes, type 2, cancers, and heart disease, and other non-communicable diseases. Also, Shank and Miltenberger, 2018, discussed the use of ACT, or acceptance and commitment therapy, as a skill training procedure to teach individuals to accept their current thinking patterns surrounding exercise and physical activity, and to create and commit to an action plan to begin an exercise workout routine to increase their overall health and quality of life. They discuss how they teach individuals to recognize their covert behaviors thinking from their history with exercise, which could be an aversive or negative thinking, and shape their thinking to be more positive, to act on with overt behaviors to engage in preferred physical activity exercise that they will enjoy. So increase their motivation in order to maintain their level in the long-term sense. So again, conducting preference assessments to evaluate what the individuals prefer in exercise and physical activities, and using that to create intervention designs. Lastly, Holland and Slowiak, in their 2021 article, recently discussed in their article how ABA interventions procedures can greatly benefit and impact for the better the population as a socially significant area of fitness health. So really focusing on that applied and behavioral dimension of ABA. They reference data from 2019 per the CDC, or Centers for Disease and Control, about obesity statistics that it affects 20% or 1 in 5 children and about 40% of U.S. adults that are 20 years of age and older are obese, and 30% are overweight. Engagement in exercise is only 23% of adults are regularly active and engaging in regular exercise and physical activity. So this is where behavior analysts, in applying ABA interventions previously discussed, can change this among the population in general. However, not every BCBA can effectively implement interventions within sports and fitness area without first obtaining competence in fitness and sports area, which is going to be discussed next. So here we have further education and training for behavior analysts who are currently practicing as BCBAs or who are prospective BCBAs that have an interest in sports, health, and fitness. So according to the Holland and Slowiak article, they suggest completing relevant coursework, which you could find in college courses, completing certification in health, sports and fitness, reviewing literature of past current BCBAs within the health, sports, and fitness area that have conducted research in different sports or fitness related areas. You could also join special interest groups within the health, sports, and fitness area. So for example, the Facebook group, Behavior Analysis in Health, Sports, and Fitness. Also, IAFRD, which is the Illinois Association for Health, PE, Recreation, and Dance. They publish a quarterly, so 4 times a year, a journal. They also have district and annual conferences that you can attend. You can also obtain professional credentials in health, sports, and fitness. So for example, coaching certification or personal training certification or fitness trainer certification as well. You can also seek out a competent BCBA who has already obtained competence in order to provide and receive supervision and training in this area. There are 4 major ethics codes in this practice for health, sports, and fitness for behavior analysts. The first one is Ethics Code 1.05, which is practicing within the scope of competence. Again, obtaining competence, which might take a while, from previous slide, finding a BCBA who is competent that would be willing to provide you with supervision and training in this area. The next code is 2.01, providing effective treatment. Again, delivering effective interventions to those clients or individuals or athletes that is effective. And then also involving clients and stakeholders, Ethics Code 2.09. So involving or including the clients with their treatment and intervention. So again, conducting preference assessments and using what they already have in their current repertoire, but also involving them in designing or creating their interventions, which brings me to 2.14 code, selecting, designing, and implementing behavior change interventions. So again, creating those evidence-based behavior analytic interventions, procedures that have been demonstrated already from research with effectively changing behaviors of individuals. Moving on to the task list items using the 5th edition task list on the BACB site. For those who are currently practicing as a BCBA or future BCBAs who have an interest in practicing within this area. The following task list items have been identified as the 5 major items to demonstrate mastery, which also fall into the intervention. So first one is D1, which is using positive and negative reinforcement. The next task list item is D4, using modeling and imitation training. So again, what the research article that Schenk and Miltenberger discuss with video modeling, expert modeling, video feedback, imitation training. So again, using that, being able to model that to coaches, to athletes and individuals. D6 item, using chaining. So again, using forward or backwards chaining. Most of the research has demonstrated effective behavior change with using backwards chaining when teaching a behavior sequence of steps. And then that goes along with D7, conducting task analyses. So mastering the creating and implementing a task analysis with those who are looking to increase their physical activity and exercise and sport performance. And the last task item is J4, selecting intervention strategies based on client preferences. So again, being able to master and conduct preference assessments to identify what activities, physical activities, exercises, or sports individuals enjoy or prefer. And this slide has the references. So again, the BACB ethics codes, the BACB 5th edition task list that were referenced, and then also the articles that were referenced within this presentation that you can access for further reading, further research in this specialty area of ABA.